I will now introduce my new GT Series X files, the next generation of shaping instruments in the field, by first discussing the design improvements and then showing their use in several cases. These are the first rotary shaping files on the market to combine safety with rapid cutting efficiency. Before this file, clinicians had to choose safe files or fast files and deal with the compromises that choice presented. No longer is that necessary. We can now have our cake and eat it too. First, GTX files are more resistant to breakage when used correctly. This was accomplished through the development of M-wire, a new form of nickel titanium that has significantly greater resistance to cyclic fatigue. Of course, if you overuse them, like any rotary file, they can break. But with this new wire, the chance of separation in curved canals has been dramatically lowered. Second, these files have radius tips and landed blades just like the standard GT files, so the resistance to apical ledging and transportation of the original canal path so loved by GT file users has been maintained. That is critical in curved canals if avoidance of perforation and accuracy of obturation is desired. Third, cutting efficiency has more than doubled because of the variable width lands designed into these instruments. Thinning the land widths at the tip and shank ends made them cut faster. Holding the mid-region lands to their original width has prevented any increase in mid-canal straightening. Fourth, the helical blade angle has been decreased, doubling the chip space and thereby allowing for twice the length of cutting cycle before these instruments stall and must be removed. This is a big factor in reducing the total time needed to finish canal preparations. Additionally, this smaller blade angle has made them more flexible. The stiffer the file, the shorter its life in curved canals. Fifth, the latch grip handles have been shortened from 13 to 11 millimeters for easier use in posterior teeth. And finally, we have reduced the size of the file set from 15 to 8 instruments and designed a technique for use that requires only 1 to 3 rotary files to cut a final ideal shape. I think you will agree that with all these design improvements, the GT Series X file line is the most sophisticated shaping instrument in the field. Let's see how they are used and how well they perform. The first shaping procedure we are going to show you is in a central incisor. This tooth has a straight canal that is fairly large along its whole length. As with all cases shaped with GTX files, the first instrument to be used is a 2006. The 2006 immediately cuts to length, therefore a 3008 is brought to play. An 08 taper is appropriate for a medium or large root. Remember, these files work with extended cutting cycles. As long as the file is advancing, we let it continue, but of course, as soon as that apical progress stalls, we pull it out, clean it, and use it again if necessary. Now I am gauging to determine whether the apical preparation is sufficient. As I expect, the number 20 NiTi K file drops through, the number 30 drops through just a bit, and the 40 binds 3/4 of a millimeter short. Therefore, visual gauging and tactile gauging reveal that we need to finish this preparation with a 0.4 millimeter apical size, so a 4008 GTX file is brought in as the final instrument. After the 4008 cuts to length, we see debris in the tip flutes. This visual gauging result should correlate with a similar tactile gauging result. As we see here, the 40K file drops just to length. Tapping on the instrument shows that it's not moving beyond, and the number 50 is binding short, indicating taper coronal to the terminus. Now, if you desire more shape than the 4008 GTX file provides, appropriate in medium and large roots only, you can bring in a 4010 from the standard GT file series. The 4010 has a larger 1.25 millimeter maximum flute diameter, so we can see it's cutting mostly with its shank flutes. That's expected. For teeth with very large apical diameters, the standard 0.12 accessory GT files with their number 50, 70, and 90 tip sizes can be used as well. We would not expect it to cut with the tip flutes as a 4008 has already been to length. The file is still cutting to length, and there we are. Now I irrigate with EDTA solution. The number 30K file drops through, the 40 binds exactly at length, and the number 50 steps back exactly 1 millimeter. So this enlargement of the coronal aspect of the preparation has not changed the apical preparation at all. That's exactly what we want to see. Here's the final X-ray showing the ideally proportioned 40-10 shape. What's very interesting to note here is that there is a mid-root curve that has been followed, and there is a subtle apical curve that the landed blades have maintained. Therefore, there is no transportation despite the large apical diameter this preparation was taken to. The next case is a lower molar with very tight canals. As usual, we start with a 2006. When it stalls, I pull it, clean it off, and put it back in. I'm not making much progress with the second cut, so I need to bring a 2004 in. Here's the 2004, and as you can see, switching down to a more narrow, more flexible taper allows me to get to length. Once that's been accomplished, I will bring the 2006 back in because I need an 06 taper minimum to allow for accurate gauging. Anytime an instrument frustrates you in its apical progress, switch down to a smaller taper. And the 2006 has reached length. Next, I will gauge, as there is not a lot of debris showing at the file tip. That may indicate that we need to go up to a size 30 at the tip. In fact, the 20 goes through by about a half a millimeter. The number 30K file is a bit short, so I'm making a choice in this case to cut to a 3006. Always go to a larger size if you have any doubts about the integrity of the apical preparation. After the 2006 is cut to length, the 3006 fairly easily goes to length in one pass. We do see light debris at the tip, therefore I expect to see a more definitive gauging result this time. The number 20 drops through, the 30 binds exactly at length, and the number 40, as expected, steps back, so we are done with that first canal. We used a 2006, a 2004, the 2006 again, and the 3006 finished the shape. So this difficult canal required a 3-file shape. In some of the mesial canals and lower molars, you may notice some clicking of these instruments. It's because of the more open blade angle. It's a little disquieting at first, but it has no effect on instrument separation. The Mesiobuccal shape is begun with a 2006. There is a fair amount of debris in the flutes, but the 2004 is being brought in because if it's similar to the other canal, it is very tight. The 2004 cuts to length, so I am now bringing the 2006 back in. The progress is slow. Again, remember that these files have long cutting cycles. As long as I'm seeing apical progress, I let them cut without additional apical pressure. If you ever feel nervous at any time with an instrument that has been used in a tough canal or two, simply bring in a new file of the same size. That was unnecessary here, and the 2006 has achieved length. And in this canal, unlike the mesial canal, the number 20K file binds very tightly and the number 30 steps back. So I had a 2-file shape in this canal. After shaping, I always clear the end of the canal with a number 15K file taken a millimeter past length. I'm in the distal canal now. Again, the 2006 is used to start off the initial shape. Because this is a medium-sized root canal, we see much quicker advancement, and in fact, on the first pass, the 2006 has achieved length. This is common in medium and large canals. Visual gauging shows a lack of debris in the tip flutes, meaning that the apical preparation will not be finished with the 20 series GTX file. I'm now bringing the 3008, the appropriate taper for a medium-sized root. Now I have debris packing the tip flutes, so I will gauge and may be done. The number 20 slips through. The number 30 K-file binds at length. Nice. Let's check it to see if the 40 steps back, and it does. So the shape in the distal canal was also a 2-file shape. Here's the final obturation result showing the 3006 in the more rightward canal, a 2006 shape in the other mesial canal, and a 3008 in the distal. Not much curvature, but quite a bit of constriction in the mesiobuccal canal. Next, I'm going to instrument another lower molar, but the root form is significantly different. Although the buccal angle X-ray shows little curvature, I think the off-angled views I show you at the end of this case will be a bit of a surprise. In this mesial canal, the 2006 rapidly cuts to length in the first cutting cycle. As there is no debris in the tip flutes, this canal will almost certainly require a larger apical shape. Just to show you what's going on here, I will do tactile gauging. Sure enough, the number 20 slips through, the number 30 steps back, so I'm going to finish the shape with a 3006. Not a lot of debris at the tip, but I will confirm final shape with tactile gauging. The number 30 binds at length, nice, a 2-file shape. In the mesiobuccal canal, the 2006 starts the shaping procedure again. It's not cutting to length as fast as it did in the mesiolingual canal. We might have more curvature in this canal, or it may just be narrower. Becoming frustrated with the 2006 GTX file, I put the 2004 in, and it immediately cuts to length, with the 2006 then to follow. It is making much more rapid progress, and in the next cutting cycle I achieve length, the reference point being the mesiobuccal cusp tip. Because I don't see any debris at the tip of the 2006, I will tactily gauge. The number 20 K-file drops through, the number 30 binds at length, so I will finish this shape with a 3006. By the way, for experienced GT file users, the new shaping objective in small roots is an 06 taper. Clinical experience over the last 25 years has indicated that an 08 taper is not only unnecessary in small roots, it's dangerous when obvious or hidden curvatures are present. The number 20 slips through, the 30 binds at length, and the 40 steps back, indicating final shape has been achieved. The 2006 is brought into the distal canal, and it immediately cuts to length, so it must be quite a bit larger than usually occurs in a medium-sized canal. The 3008 is the next instrument, and 08 taper is the shaping objective I'm looking for in medium and large canals. As I achieve length, we see that the 3008 shows debris all the way to the tip. Now we also see that a number 30 K-file binding at length indicates that the shape is complete. Nice, another 2-file shape. Let's look at the post-fill radiographs now. I think you will agree that we see a very interesting anatomy here. What I want you to notice is that in the buccal view, these canals appear to be relatively straight. Maybe a little bit of reverse curvature at the apex of the mesial root. The distal root has a little bit of coronal curvature. If we only refer to this buccal view, we would think that there was not much curvature to the root structure. Watch what appears as I take increasingly angular views of this tooth. In the second view, we see a slight distal curve in the mesial root structure, and we are starting to see way more curvature in the distal root. Now, the third image shows that both the mesial and distal root canals had really significant curvature. literally 60 to 80 degrees of curvature. Wow! If we had only considered the straight-on image, we might have expected the files to cut to length very easily. Now finally, we see the straight mesial view showing the confluence of the mesiobuccal and mesiolingual canals. I want you also to notice that the mesiolingual canal on the right has a smooth continuous curve, and as is so often the case in confluent canals, one of these canals has a more acute curvature to traverse. Fortunately, in this case, the mesiolingual canal was shaped first, freeing up the file tip when the adjacent canal was shaped. Be very wary when files resist apical progress. Do not assume you are aware of the true curvatures the file is meeting in the hidden canal space.